We're here to talk about the National Text Platform for 211 that we sort of announced at the beginning of December is accessible to anybody. So today we will, have a run through some presentations with. I'll start it off. We'll turn it over to Larry Olness at the Heart of Florida United Way, and then Tom Evans with the actual provider of the service. Answer some of the questions that we've already gotten, but then at the end of the call, and I think maybe even midway through the call if we need to, we will open it up for your questions. So get ready to ask your questions. But I want to lay out kind of how we're thinking about this now. And you'll see at the bottom of the screen it says text any zip code to 898211 in the U.S. now and receive information about 211. That's kind of what we want to be able to do across the country. So if you will feed zip codes to Larry, he can add you to a database, and then anyone who texts their zip code to that number can either, if you're a customer on the platform of 898211, begin a fully integrated text chat with the people you're talking to, the people who started it. If someone's not a customer of 898211 through Prevention Pays in the Heart of Florida United Way, they'll at least be able to get information about how to contact their local 211. That was important to us as we were picking a platform that we wanted to sort of recommend nationally, was that we recognize that not everybody's a customer of 898211, where people have other deals or they can't put it in their budget immediately. We want to be able to make sure everyone who is a 211 at least has a way to, when people text 898211, get in contact with their customer. So we can go to the next slide. Couple things just kind of to know about text, and I'm not going to read slides to people, but it is by far the thing that people do on their mobile phones a lot more than getting on their voice app. As my wife calls it for my daughter, who's a teenager, she barely knows how to actually call someone live on the phone, but she texts all the time. And as the Pew research has been showing us, that's actually been evolving so that it's not just people my daughter's age, but even people my father's age who are now using their phone for texting more than for voicemailing. Something that we did as we did some research into this, we think that there are literally millions of contacts across the country with 211s that we are not getting because we don't have text ability throughout the country, where we looked at where there have been texting for a while and extrapolated from that. People that promote texting get an impressive bump in their contacts, and yet it's still a pretty efficient medium, so we'll talk about that in a second. You'll notice that for outbound, for those of you who want to try to use the platform, if you purchase it for various campaigns, whether it's fundraising or public health type campaigns, people are opening texts at a far, far greater rate than they do with emails. So that's, I think, a useful sort of set of stats there. If we can go to the next slide. The 211 QA work group, Quality Assurance Work Group, there's no and, was an outgrowth of the 211 CEO work group a couple of years ago. They were charged with, well, actually, maybe I should let Larry Olness, Senior VP for, well, actually, Larry, you're Senior VP of a lot of different things at Heart of Florida United. So I never remember Larry's full title. But Larry, you kind of headed up the 211 QA work groups. Maybe talk just a little bit about sort of what the charge was and where you all took it.
I would be pleased to, and thank you, Russ. And let me just, before I go on to that slide, I just want to take a step back. You can kick the slide up where it is, but Russ mentioned the fact that we are missing a number of folks on a daily basis and annually. Our experience here at Heart of Florida has been that about 98% of the folks that contact us via text have never reached out to 211 in the past. They have not done so because we do not have a text option. So there are folks that need our service, but we're looking elsewhere for the help they need because of the fact that text is not available. And another very interesting fact is there are times in any conversation, whether it be text or chat, whatever, where it makes sense to have a voice conversation. we have found that 99% of the folks that text us, when given the voice option, decline. They started on text, they want to stay on text. And a third point is, we'll talk about this more later, we know for a fact that there are in excess of 100 folks a day across the country texting 898-211 to zip codes that don't have a route other than to say contact your local 211. So there is a huge pent-up demand, there is a huge market for it, and we are very pleased to be able to offer this opportunity to start to meet that demand. So let me go back to where Russ passes off to me. The 211 QA work group was established, as Russ mentioned, as part of the CEO work group, and it started with a very simple premise. There were a number of folks around the country that were funding 211, and they're asking the question, well, how do I know what I'm funding is in fact a good 211, or what is a benchmark of a good 211? So they created the work group to kind of put some metrics in place, some KPIs in place, and some standards in place that they could use to be able to measure where they were and what they're funding against what was some national standards. And this work took, about a year, because we worked with a number of 211s across the country and some professionals in the call center world to establish those numbers. And at the end, we put that in place. We shared it with the folks at 211 US and the folks at AIRS to get their advice and buy-in as well. And at the end of that work, the metrics and so forth were established, but we also established a scorecard. And the scorecard is sent out to 211s that voluntarily agreed to participate to establish a benchmark. So they can just measure to see where they're at and use that to help us to continue to define the metrics. One of the things that would occur during the process was, in addition to the KPIs and so forth, we also looked at what you need to do in terms of technology. And it was determined that you need to be able to offer, telephone service and live email and chat, but you also need to offer text. And as part of that work, the work group charged us with developing a national text platform that could be used across the country to take advantage of the opportunity and the need, and also not only opportunity for interaction, but opportunity for funding that could be driven back to the system. So we worked on that for a couple of years actually, and looking at different providers, looking at different options, and it became very clear to us that the text in 98211 was the best option. So one of the charges as well was to make sure that it was cost effective, and we're going to talk more about that in a little bit. And finally, before we brought it out to the larger network, we wanted to make sure that the various CRM vendors were on board. So we had a meeting in New York this last August 22nd, 23rd, and we had folks from RTM Refer, VisionLink, IKEO, and Bowman Systems laid the program out, laid the vision out, and they all unanimously agreed to buy into using the 898-211 platform for delivery of tech services through the on-demand service, which we'll talk about later. So I'm very pleased to share that we have a fully deployed system, fully operational today, because we deliver on the national initiative today, and that the major vendors in our world, in our world, have all agreed to be part of the solution. So if you would please go to the next slide. Next slide, please. So I just want to give you an update on what's happened with to date on the platform. And I'm not going to read all through all this, but you should know that the 898-211 platform is currently available across 25 states, actively across 25 states, 67 sites. That we are beginning today the national call to action, and we'll explain more about that, but we want every 211 to be part of this, And the good news is you can be part of this at no cost, which we'll talk about shortly. As I mentioned, it's fully deployed. So right now, anywhere in the country, a person can dial 898, text 898-211, and they'll get a response. Now, currently, if you are not a client, or if you have not submitted your zip codes, you get a generic message. The message says, please contact your local 211. What we want to do is change that so it is a specific message that you want your clients to see. We are also working on integrating the system so we can do automatic surveys, we can do automatic follow-ups, so we can be able to roll up data and report it, because one of our challenges right now across the network that's kind of limiting our ability to do funding is the inability to report data, and unfortunately the inconsistency across some of the systems based on capacity. So we are addressing all that through this platform. 211 on Demand is an exciting opportunity that exists. I'm going to talk about that more later, but it will dramatically change how you do your business, and both in terms of collecting data, sharing data, and becoming more effective. We see the platform as it's currently deployed as the ability to be used nationally and regionally and locally for disaster response and alerts. That's currently in place and available. We have developed the framework so it can roll up information to a national level to a platform such as 211 Counts, or to a freestanding platform, or whatever errors in the way come up with in order in terms of reporting. And I think one very, very, very important technology that has evolved, and it says Indiana statewide model because they're a prime example, is the ability to load balance. So, for example, if you have an unexpected surge in text, that can be rolled across the network or to a defined area. If you have someone who is out because of snowstorms like that, it can be rolled automatically, and it's seamless. And you capture the data within your system. So, we can truly today deliver a national network that is load balanced, that is robust, that can capture data, and will help us not only support the clients we deal with, but also we believe very strongly draw funders to be able to help us get some dollars back into the system and back into our local United Ways. And because the system has been in place and has been built upon for the last 2 years, and in some cases longer, there are currently over 1,000 trained operators that are able to respond today to those kinds of situations. And we hope to grow that number exponentially over the next several months. Next slide, please. This is just an illustration of the active sites right now. And I should say this thing is changing daily based on the call for action that Russ put out. I do want to acknowledge and thank Hawaii, who has submitted their information, Kentucky that submitted their information, to parts of Florida that submitted their information. This is growing rapidly. And as I mentioned, over a third of the 211s are currently on board, and that is growing. So we truly do have a national, robust platform that we can share and build upon. Next slide, please. So just a quick recap of what we've talked about. We are currently, with the active sites, serving over 97 million U.S. residents. The current population in the U.S. is about 318 million, so almost a third of the country is already covered by the text actively. 30% of the 211 sites are on board, and more importantly, or I should say a little important, is the fact that we currently have 10 of the 10 FEMA zone coverage, so that creates opportunities for national funding because we can clearly deliver a national product that meets their requirements to have a site in every location. Next slide, please. So what's the goals? The goals is to ensure we have a robust national system to support national initiatives. There are currently 2 sites working on a Homeland Security initiative, a demo, and the hope is if the demo is successful, as we know and believe it will be, that there will be national funding to support 211s involved in that effort. We want to ensure that there's high quality text available to all Americans using the 898.211 platform. And finally, we want to configure a national network of sites that even in the interim, as we build the system to its full build out, can respond. So, and we think we have that in place right now. But we are hoping that many of you who will join the free opportunity will see the advantages and help us build it out to be fully robust and take advantages of additional funding that we think that will occur. Next slide, please. So the strategies. We want to add to the national registry. As I mentioned, over 30% of the 211s are on board. And I'm going to share with you the advantages of being part of that registry and the advantages that are free that will help you better meet your community needs and also become part of this effort. We are going to aggressively pursue opportunities to fund the system, but more importantly, bring dollars back into your 211s. We believe there are significant opportunities, be it across Homeland Security, the CDC, other opportunities that we have in fact been approached about before, but because we didn't have a national system we couldn't take advantage of. We think that can happen. We think it can happen sooner rather than later. There's been a lot of discussion over the last 20 years about, it'd be great if we could raise some money that we could push back to the 211s. We see this as the opportunity to do that. We continue to work on advances to the system. I mentioned load balancing. We're doing automated surveys. We're doing automatic backup into CRM. And we continue to look for ways, and you're going to hear some of them shortly, to make the system work better for the 211s that want to go beyond just basically having a recorded message and their clients. Working very much to support the network sites, and what we're talking about today is basically a call to action in 2 steps. The call to action to the country to text 211 so they can make connections with you, and secondarily for you to text the zip codes to 898-211 so we can have those in place to be able to respond. So let's get around to what this is all about. What's the motivation? Why should we do this other than the greater good of the country? Next slide, please. When you send me your zip codes, a number of things are going to happen. One, you're automatically going to have a text code available to you to be able to use in your service area for any type of disaster need. So, for example, flooding, tornado, fire, whatever. We're going to give you a text code that you can populate with information and send it out to the community as needed. So the 898-211, they'll put it, and that'll be available to help you respond. No charge, no effort, just simply that's available. Secondarily, we're going to ask you to create a customized response. So when a person texts 898-211 and then gives us a zip code, instead of seeing a generic text that says, please contact your local 211, it'll be customized. So it can be customized to say, please contact Heart of Florida United Way 211, or it could be the website, or it could be a telephone number. So it's customized based on what you feel is the best way to communicate with your clients who are reaching out to you in the interim. We're also going to give you a donation gateway. So during the disaster, if a person wants to donate financially or donate resources, you're going to have that tool available for you as well. Both the surge protection for emergency uses and the open donation don't require a two-way dialogue. It's a one-way push that you'll be able to manage. And finally, we're going to give you API support for CMR integration. So as we mentioned, we are working with the major vendors, which will allow you to be able to have your data sent out via text and also captured within your client records. But most importantly, we're all doing it because we're all going to be using the text 898 2-in-1 platform. So I hope you will see the advantages of getting on board. I hope you will see that there's, as I mentioned, free services, but free services that I think will be very valuable to you and to your community at all times. So let's go to the next slide. I want to just give you a real quick couple examples of things that are happening right now. And for the point of full disclosure, these are folks that have signed on to the system. But let me just give you some examples to kind of give you a preview of some of the possibilities that exist. The first example I'm going to use is Atlanta. Atlanta has a population of about 6 million. They use one INRQ, and it's done for both live two-way interaction and phone to text. So they average about 5,000 contacts monthly. About 55 daily texts occur, and of that they do about 70 referrals, from 740 referrals. So what that means is they will start with a phone call and transition that to a text response. Because what they have found and others have found is a client prefers to get a text into them so it is on their device, they can see it and track much easier than telling a person, could you please grab a pencil and give this information to you. It's a very effective tool. It allows the clients to access the resource when they want. It guarantees that the information is correct and accurate, as opposed to the possibility I can't find a pen, I transcribed this number wrong, and so forth. So it has proven to be a very, very, very effective tool for Atlanta. And the important part is they were able to better serve their clients without adding additional staff. In fact, they're serving more clients more effectively with the same dollars. The second example I want to show you is, and here's where my bias comes in. I'm going to show you our operation. What we do differently is we rely a whole lot on push programs. And what that has allowed us to do is reach a population that we would not normally contact 2-in-1. So we have push programs related to college access. We have push programs related to Text for Tots, which is childbirth to early adolescence in terms of being able to measure performance against. We have a program related to financial stability. We have a program related to the military. We have a program related to Help Me Grow. So we use it a lot. What that does is that generates the calls back to us. So in Atlanta's case, the calls come into them on the phone and they push out a text. In our example, in our model, the text generates the text encounters. And as I mentioned, it's a way to reach targeted populations. A lot of the folks we have long-term commitments with, relationships with, because, for example, a college program, maybe 2 to 4 years, early childhood, 0 to 5, so it's an ongoing relationship with those individuals who are, in part, are typical callers, but more and more and more it's folks that are not typical callers, but clearly see the value of our services. Another unique piece that we have is because we do have text available, we also make it available to our CBOs and other agencies to be able to also be part of a network. So I no longer have to do a email appointment or go on to Appointments Plus to appointment. I can just send a text back and forth and do clients that way. So, and they can as well to me. So it's two-way texting. So we do that, provide that service to our community to build a network at no cost to them. So once again, a further enhancement of what can be done. Next slide, please. So 211 on demand. I mentioned that briefly. I am extremely proud of this, partly because it was my idea in talking, but second because it's changed the way we do our business. The way 211 on demand works is we advertise in the community to contact 898-211 with a keyword, and the keyword can be, energy or whatever it happens to be. It goes into our database. It pulls up the most current effective resource to meet their need or based on what they told us where their area is. It sends it out to them onto their device so they have that information. It captures the fact that they contacted us in our records, in our CRM records. It generates in a predetermined amount of time, 3 to 5 days, a follow-up text asking them if their need was met and the rate of service. That survey information is also captured and given back to us. So we have a complete automated interaction. It also, at any point in time in the interaction, gives the opportunity for them to go from a one-way interaction to a live interaction. It has proven to be very, very, very beneficial to the users. It has allowed us to, once again, to meet folks where they're at. It has allowed us to increase the number of folks that deal with us without having to add staff. And it just has opened another way to meet the needs of clients effectively. It also, as I mentioned before, allows for us to be able to handle unexpected phone surges because we can push them off to that. It's just been a great tool. It allows us to not only capture the information in our system, but also roll it to a dashboard. I mentioned the full CRM integration, and it also creates the opportunity to do a text-to-give application the same way. So I know that this is being used at a number of places across the country, and they are reporting back very, very, very favorable results from the users. Next slide, please. So, what to expect? This is what we've gathered from the folks in the country that are currently using the system to its full capacity. They have all, or the majority of them, without adding any staff, because what you will find is that a person can multitask, so they can do a phone call and 2 texts, or 3 chats and 2 texts, or they can multitask, deal with more clients without adding additional staff. Deployments of sites is done at shared pace, but is very incremental, very controlled, and very, very user-friendly. And as I mentioned, we have the infrastructure in place right now to deliver on national initiatives, but also on local and regional initiatives very quickly. Next slide, please. What I wanted to do is just very, very quickly just give you a sense of what some other folks are doing. And the reason I'm doing this is because I think it's important to know that this platform is very versatile, and the only limitation is your imagination. So, Indiana, for example, is, as I mentioned, the whole state is able to load balance and share text around 6 211s, and therefore they can cover each other at any point in time and have a continuous system in place. Washington has been offering text since 2012, and the same kind of thing. They're able to manage hundreds and hundreds a day without their problem. Milwaukee uses it for a food bank referral utility. Next slide, please. Oklahoma does it for utility inquiries. Connecticut uses it for food bank. California uses it for homeless subscribers to let them know when shelters are available. Next slide. Pennsylvania uses it for tax season. We use it for everything. It is our community brand. I mentioned the Text for Tots program. We use it for volunteer events. We use it for donation events. We use it for everything. And Helpline Center 211 uses it for storm warning text programs. So here again, I've shared with you the national plan, but the reality is, we've tried to create a platform that, as I mentioned, is only limited by your imagination. Next slide, please. So what I've done is just capture some of the comments we've heard from the various 211 sites around the country that are using the platform. The specialist preferred is a very easy to use system. The end client has said they love the convenience, they love the fact that it's an option, and they would highly recommend. Next slide. Just some more statements. The fact that adding texting is very easy. Text rates keep going up, and I can attest to that. Our call volume has over the last several years, obviously been impacted by the economy and other issues, but in and of itself, our text continues to grow exponentially. Our chats are basically flat. Our call volume is down, but it's down because they're choosing to go the text route. I think you will find that as well. And what we'll find is the more we use text, the more our specialists use text. They are now able to do 4 or 5 texts at a time, which would replace one telephone call. Next slide. So most importantly, I know the issue of what's this going to cost? How are we going to, what's it mean for me? First off, remember that the 4 items I mentioned come to be free: the disaster response, the donation response, the message, specialized message, and also the CRM piece. But if you want to take advantage and join the system sooner, if you have an existing contract, there will be no increase in your pricing, and the automatic renewal provision will be in place. So no increase for existing contracts. Secondarily, if you were to sign on now, the cost would be 0.00417 per person in your selected zip code. If your population that you serve is under 1 million people, and that's about 80% of the 211s across the country, you will see a substantial savings over what was the previous contract. The previous price was $59.95. There were some specials to get folks, early adopters, into it that brought down to $49.95. The majority of folks will see a cost much less than that, thanks to United Way working to make this a reality. There are some population areas that are greater than 1 million people, and we will work with them to make sure that we don't cost this, even at the 0.00417, to prohibit them to be part of this, because we need the whole country to be on this. There's a handout that'll be available to download from the webinar going forward. So next slide, please. I've listed our contact information, Russ, myself, and the folks at Prevention Pay. What I'd like to do is open it up to questions. I know I've been through a lot. This will be recorded, and we'll also have the information available to you. But I would love to answer any questions, or Russ would, or Tom would as well. So if you would please open that up.
Okay, thank you very much. This is Jonathan, and I'm with Educational Message Services and Prevention Pays Text, and we have a few questions. Number one, first question is, how does 211 integrate with existing platforms such as ReferNet, VisionLink, and iTero? In other words, if we were to implement Text 211 in our area, how do we work with our INR software vendor to implement text?
The good news is you don't need to. The good news is that we have worked with them to begin this process. We are providing them the APIs to make that happen. So you should be hearing from your CRM vendor very shortly. ReferNet's already up. VisionLink is in process. The other two we are working with. So we've got that handled. But if you have any questions, please reach out to me, and I will help you make that happen.
Thank you very much. Thank you for your question. That question was from Gary Lever. And the next question is, does the free API support for CRM integration include APIs for any CRMs or only for the INR vendors you mentioned?
We have only been in discussion with the INR vendors that we mentioned because they were the major ones at the table. But we are very much committed to making this available across the system. So if there's somebody we have not talked to, please let me know where we talk to them. You know, we want to ensure that every 211 has access to this, and everybody in the country has access. Thank
you, Claire Okasayan. I hope I pronounced that right, Okasayan. The 0.00417 cents a minute per person. I'm sorry, that's per minute. That's total cost. So just so we're clear, say you had 1,000 people, then that you served, then your cost on an annualized basis would be $41.70. So that's how we're pricing this is population on an annualized basis. Thank you. If we send our zip codes without signing on, can we get a report of attempts to reach us? Yes. But like anything else, I mean, and like anything else, that until you either we market it nationally or regionally, or you make it available, you're not gonna have advantage of the full spectrum what could be. You're only gonna know the folks that have done that because they've heard other places. But we would be happy to provide a report for you. Okay. If you do here's a question, and I'm not certain that, Larry, you can answer this. I sent a test email with the Placer County email, which does not have 211 to see what would happen. It got directed to Nevada State 211. Why would that happen? There is no email support with the texting. If you send a text to 898211 and it's not an active zip code, it will send back that please either enter another zip code or call 211. There is no direction to any specific 211.
Jonathan and Larry, that's Russ Paulson at UWW. If the person who submitted that is referring to a website problem, then that's something I need to know about here at UWW since we run the website. So maybe this is something that we want to handle offline if there's an issue with something going wrong there. That sounds great, Russ. Thanks.
Okay, how are texts routed to the proper zip code? Is the zip code given by the texting customer?
Yeah, the zip code is given by the texting customer. We didn't go into all the other opportunities to use keywords, but for the purpose of this initial rollout, every zip code in the country is entered in the system already, and it's attached right now generically to simply say contact your local 211. Once you tell us what zip codes you handle, we will go back in and change the message so it is specific to the response that you want for that community.
So it's Russ at UWW. So if we were to put out a national campaign for this,
right,
the message, the call to action for someone would be text your zip code to 898-211. When they texted their zip code, then that refers to that table that Larry's talking about that will route to the right 211.
Right, absolutely.
Is AHT and ASA reporting available?
I'm not sure that, this is Russ again at UWW. I'm not sure that those metrics are the right metrics for a texting session. When you have a texting session with a client, you're sort of dependent on the client getting back to you. So I don't know, Larry, the platform has an average speed of answer equivalent, but handle time is going to be a lot dependent on how long it takes the client to respond to you. So often a client will send a text in, and I've sat there in 211 centers and watched this, where a client sends a text in, the 211 center specialist, navigator, whatever you want to call that person, will send an immediate text back, but then you wait for the client for maybe 15 minutes before they send something else back. So I don't know if handle time is a logical thing. Speed of answer is something that there probably ought to be an analog for, but Larry,
right, that's a great explanation, Russ. We actually do have some standards that we applied based, quite frankly, on what the American Society of Suicidology puts in place for their things in terms of, how quick you respond to a person. But one of the advantages that I mentioned is the ability to have a staff handle multiple interactions, and that's in part because of the spacing of the responses. You couldn't sit on the phone waiting for a person 15 minutes to respond to you, but you can do it in a text environment and handle multiple interactions during that time. But we do have some KPIs that we've established that we can share with the field to kind of use as benchmarks. So how are we doing on the questions? We have
okay. We do. Just a moment. Okay, so just to answer the questions about the zip code, texting your zip code to 898-211, it's just your zip code. And if you text something wrong, you're going to get a bounce back asking you to text in another zip code or call 211. So it's you're not trying to put multiple zip codes in or try to cover as a 211. You're serving zip codes in the counties that you serve, and so when you become part of the platform, you're submitting your zip codes for that, so that we change your zip codes to a live response, and we do this and work with you so that you are prepared to take those live texts. And then, of course, anyone who texts a zip code that's going to be in your service area would then get the automatic messages that you've created for your site, and then all of that traffic you get to count. It's in your reports, and it's in your service area.
And just to be clear, you won't have a live interaction until you decide to get on the platform, but you will get a message you want them to go out in the interim when you sign up to be part of this. So any more questions?
Yeah, so we did have a test, and somebody sent a test text, and they got the response back, sorry, we don't understand what you're saying. Please only text the keyword or zip code for the program you're trying to reach, or dial 211. So that is the bounce back for zip codes that currently are not active. We are working. Yeah, go ahead. Sorry.
No, and we want to change that. We want to change back so it says that this is your 211. Via website or whatever you determine that you want.
Right. So that's what folks. Just so we're clear, this is Russ again. So that's the ask for now, regardless of whether you want to sign up as a customer, is to send Larry Olness your zip codes so that bounce back message can be customized for your 211. Right, Larry?
Yeah, absolutely.
You have mentioned several possible funding opportunities. Is that just a national level for the overall platform, or would local 211s also benefit from such funding opportunities?
Larry, you've gotten a lot of those locally in Orlando. So why don't you talk about what the Orlando experience has been?
We have gotten a number of funding opportunities. We got funding to do the College Access Network. We got college to do the Text for Tots program. We have additional discussions all the time with folks that want to use our texting platform. So I think there are local opportunities, there are regional opportunities, and there are national opportunities. So I think that I shared some of the exciting things that are happening. I know those folks have turned those exciting opportunities into dollars in some cases. People want to reach people, and they want to reach people effectively. And what we are finding, based on all the various studies, that text is the preferred communication method, and people actually open and respond to text. And what we didn't put on here, people actually, once they become part of a text interaction, they continue to be on that. So if they sign on to a push platform, they don't walk away after one interaction. They continue to be a client, and because it meets their need, because the information is relevant, because they've asked for it. It's stored, and they can get to it when they want to. So it's opened a whole new world, a whole number of clients you've not dealt with, and enormous amount of potential funding.
And Larry, if I could just add on from the UWW perspective, if there ever is national funding that goes with this, it is not ever my goal, and it's not been our practice when we have achieved national funding, to sort of hoard it all at UWW. Many of you who participate in either My Free Taxes or Flu On Call or one of our other programs have discovered, when the 211 network gets engaged to do additional work because there's funding that flows to headquarters, or UWW, the funding then flows from UWW down to the local centers. There's rarely a point where a national funder gives us something that we just keep here. I haven't seen that in my time here.
I didn't go into my whole history, but I've been in the system for 21 years, and INR for 21 years, and 211 most of that time. I have seen opportunities and heard about opportunities, been discussed with opportunities where we couldn't say yes because we didn't have a national system. We couldn't guarantee that the response, that the inquiry would be answered. We now can tell any funder with 100% certainty that we have a national system that's available across the country that can be answered, can be reported on, and can be timely as you want it to be. So if, for example, the CDC came to us today and said we want to send out a notification about Zika to the country, we can do that this quick. And if they wanted to say we also want the ability for a person that gets that information to be able to have a two-way dialogue, we can guarantee that because of the numbers 211s that are already in place, which we hope you join. So we really have something that the folks around the country have been asking us for that we've not been able to deliver in the past. So it really is an exciting time and an exciting opportunity. And I say that because I've been at a table where we had to say no, and I don't ever want to say no to dollars, to the 211s, and back to the system. So let me just.
Okay.
I don't know if there's any more questions or not, but what I wanted to do is, I want to make sure everybody have my contact information so I can continue to answer questions. Encourage you to send me your zip codes. And what we wanted to do is we wanted to do a short demo so you can kind of experience the text platform if you have not in the past. So is there any more questions? Or if not, I'd like to do that demo because I think that's a great way to handle the process.
There are, Larry, thank you. There's a lot of questions, and that's fine. We're going to take all of the questions, and we're going to provide written responses to everybody who has still pending questions, so that we do have time to jump over and look at a short demonstration. So we're going to go ahead and do that now. So thank you very much. We're going to jump away from these slides, and we're going to go to the user interface to provide an example. Okay, so when somebody, just one moment please. Okay, so when somebody texts in a zip code and it's in your service area, your queue will populate with that request. So kind of like how email works, where you have an inbox, that's what this is. This is the inbox for the texting. And so this gives you an idea of what the queue actually looks like. Okay, so when I open up a case, I get the text box, and I also get a bank of canned messages. So when somebody texts their zip code, and we're just using a fictitious zip code here, we're not using one of the real zip codes, this is just a demonstration. What happens after they text their zip code is fully automated. So they get the opt-in message, and it's from your agency. So you define what it is that is told to each client when they initiate a text conversation. On the right-hand side, the specialist has a group of canned messages. Canned messages can be as many as you need. They can also be issue-specific, so that you can really drill down on specific issues, because we know with INR it can be super complicated. A single issue can have a lot of questions, can have a lot of back and forth. Therefore, if you can segment out your canned messages so that it's just a toggle between the issues, you can have a default. You can also have a library that is for specific specialists, for their own personal canned message library, and that is a permission-based component. So when the client responds back, so we get updated. Now, all of this so far is automated, right? What we're asking them. And this is all customizable. So I have yet to send or type a message to this client. And if I look over here on my canned messages, that canned message is appropriate for this next response, because I know they texted from this zip code and they're asking for some utility help. When you send the message out, it's supported by carrier-grade message tracking. So that means all the carriers know about 898.211, and they've provisioned it for 211-related services. INR and push programs. And so carrier-grade message tracking just means that every message that is being sent is being supported by the carrier, notifying the application, the platform, when messages get acknowledged by them and then actually delivered to the mobile handset in question. So all messages are tracked that way. So as we move through a live INR, we can utilize the canned messages for much of that, so that we're limiting the amount of hand typing that any specialist is doing. And as you get good navigating through these the canned message libraries, you would be able to find a transition message or a closure message, or depending on the issue that you're working on. There's potentially a canned message library for every scenario. Now, of course, things become, if it's a multi-issue, it can get more complicated, but you can really use the canned message libraries to help facilitate as much as possible migrating through even the more complex issues. So we're going to hop over, once we know that they need help and they're seeking assistance with their bill and they're seeking it for electric, then we can, and this is just an example, guys, this is just an example of a CRM search or lookup. And so I'm going to hop over to temporary financial assistance and utility assistance. And then I can take and copy that information straight from the CRM. And I can move this box, make it bigger, smaller. I can add additional referrals here. I don't have to format this before sending it. The text box will automatically format by removing extra spaces and extra line breaks. And when I'm ready to send, I send it. The end user gets the referral. I may have an additional message that I ask if there's anything else that they need. And when the client texts back, and then there might be one final message back saying I'm going to close the message. Now this is important. When I close this message, we have an automated quality assurance survey that's attached to this encounter. So this is an example of a live encounter, a live INR counter on 898.211. And then at the end of that live INR encounter, based on closing this case, I'm going to fire off a completely customizable survey. So I close this case, it archives, and if I happen to be viewing the case, I'll watch and see as that survey gets assigned. And you get to see it being assigned right here and right in the dialogue. And then, that can be triggered at any time. So you can close the case and it fire or start 5 minutes from now, or you can close the case and it start 5 days from now, or 7 days from now, or however long you want, and whatever survey questions you have, so that you're working through any kind of quality assurance questions that you may have. And it's
Guys,
being done so
hang on
in a
one
fully
second.
automated way.
Jonathan
Yeah.
and Tom and Larry, just hang on 1 second. It's Russ again. We are 5 minutes over time
Okay.
already, and I just want to respect people's time. If people want to hang on to the webinar and get an additional time on the demo, then that's fine. But can we put back up the slide so that folks can have the contact information again for people who do need to drop off? If we could once again put up the slide for contact information, you'll see in a second. I guess we're all the way at the front of the deck now. But you'll see the email for me here at United Way Worldwide. You'll see Larry's email in Orlando. And then you'll also see the way to contact Prevention Pays directly. And I don't think we really have time to describe who to contact when. I would say in general, Larry has the best knowledge of how the system works locally, and also has the master agreement with Prevention Pays. So when in doubt, contact Larry.
Right.
And if you have a concept of how this could or should work differently across the country, feel free to let me know. And if you have a technical question, I guess, about the system, then that's probably the time to contact Prevention Pays. Is that how you'd suggest it, Larry?
Yep. And Russ, thank you for that. And I want to thank everybody for being part of this. We actually had over 150 people, so some folks couldn't get on, so we're going to repeat this. But thank you very much. I look forward to working with all of you to deliver this nationally, and also get money back into your operations. So thank you. Have a wonderful holiday season. Bye.
All right. Thanks, everybody.
Thank you.
Jonathan?